move on to the next. Okay. Sige. So we are still on the discussion of the compounds of sodium. So we have here number 3, sodium dihydrogen phosphate or NH2PO4. In the pharmacy, we used to call this as split enema. Ang gamit nito class is cathartic. Pag sinabing cathartic, ano yan siya ha? Laxative. Pampabawas. Okay, pampabawas yung sodium dihydrogen phosphate. So actually, itong sodium dihydrogen phosphate, it's a lubricant laxative na it will absorb water doon papunta sa stool ha, from the bowel to the stool para mag-soften yung stool and then madali siyang ilabas. So yung mukha nito, parang lalagyan ng toyo like this one. And then meron siyang parang ganito. Ito yung i-insert sa anus actually. Sa anus talaga siya i-insert and then we will empty the content of this container. And then again, it will soften the bowel para malabas siya. Now, this is good for people with constipation or for those na kailangan mag-undergo ng processes like colonoscopy, endoscopy, yung sa diagnosis. Kasi pag merong mga ganun na processes, di ba, nagpapasok ng camera sa loob, and then titingnan what is wrong, bakit merong signs and symptoms sa gastrointestinal tract na na-experience ang patient. Now, the doctor cannot see anything if merong obstruction. The stool there becomes an obstruction. That is why before the procedure, kailangan ilabas yon. And we may use split enema for that. Again, because this one is a laxative. And then at the same time, aside from being a laxative, this is also used as a urinary acidifier. So, kabaliktaran ito kanina ng sodium acetate and sodium bicarbonate na mga alkaline sila, mga basic substances sila, and they may be used to alkalinize the urine. This time, si sodium dihydrogen phosphate is an acidic substance. So, ginagamit naman siya as urinary acidifier. So, like in the case of poisoning of a basic substance, we may acidify the urine para madali siyang ma-excrete. And aside from that, sinasabay ito with methenamine. So, itong methenamine class is antibacterial. Okay, ginagamit actually ito for UTI. So, si UTI is not caused by eating junk foods or drinking carbonated drinks like Coke. It's actually a bacterial infection. Okay? So, ang reason lang talaga niyan, you may be unhygienic, kaya ka nagkaroon ng bacterial infection doon sa urinary tract mo, or you may be sexually active. So, yun yung possible reasons why bacteria move into your urinary tract. Okay, mag-cause siya ng infection. However, yung mga sinasabi nila na like junk foods or Coke, those are triggering factors. Okay, triggering factors pero they are not causes. Pwede lang sila mag-trigger ng UTI attack. Hindi yan sila mag-trigger kung hindi ka pa naka-experience ng UTI. So magti-trigger lang yan ng recurrent na yung pabalik-balik na siya na UTI. Kasi 'di ba, pagkain din yan siya ng bacteria eh. Pag for example, mahilig ka sa Coke or mahilig ka sa junk foods. Yung sa junk foods, syempre salt yun siya. Then sabi ko kanina kung nasaan si sodium, pupunta din doon si water. So yung madedehydrate kasi yung tract mo niyan because of the too much intake of the sodium and therefore magkaka-problem tayo with your urinary tract. Okay? So those are just triggering factors. Therefore, if naka-experience ka na ng UTI, those foods are to be avoided. Pero kung hindi ka pa naman naka-experience ng UTI, you really just have to be hygienic para hindi ka maka-experience ng UTI. Or kung naka-experience ka naman, maging hygienic ka din. Pero yung mga sexually active talaga, mas prone, mataas yung risk for UTI talaga for people na sexually active. So be very careful. So like girls, ano siya ha, yung for example, napkins are just to be used for 4 to 5 hours only, and you need to really change that mapuno man yan or hindi. Hindi pwedeng isa ka adlaw, isa ka napkin food ka. That's very unhygienic and it may cause UTI. Yung mga mahilig gumamit ng, ang tawag dyan? Yung good for 2 hours. Panty liner. Yung mga mahilig gumamit ng panty liners are good for 2 hours only. So every 2 hours, kailangan mo magpalit ng panty liner class. Pag hindi ka nagpalit, prone, and then you will have high risk for UTI also. So kung gusto mong gumamit talaga ng panty liner, magbaon ka ng marami sa isang araw. Okay? And then you change. Now, ito, si methenamine is a drug for UTI. Kaya lang kasi si methenamine itself is not really capable of killing the bacteria. It needs to be converted first. And methenamine will only be converted if the environment is acidic. So remember, sabi ko kanina, si sodium dihydrogen phosphate is an acidic drug. So methenamine plus the sodium dihydrogen phosphate, this will lead to the formation of, sorry, bakit ganyan ang right ko? This should be formaldehyde. Formaldehyde. Si formaldehyde na class yung totoong capable of killing bacteria. Okay? So like for UTI. So kailangan mo nang i-acidify. Actually, it will become formaldehyde. It will release formaldehyde if the pH is 5.5. And remember, it's below 7. So acidic talaga yung environment na needed for the methenamine to be activated. Okay? Now, another compound is the sodium bisulfate. Sodium bisulfite, or we call this sodium metabisulfite. This time naman, it's a water-soluble antioxidant. From the name itself, antioxidant, this will prevent oxidation. Oxidation happens if you have the presence of oxygen, or you will have or there will be a loss of hydrogen. So it's either of the two. Pwedeng because of the presence of oxygen or because you lose a hydrogen. Yan yung reason why there is oxidation. And for pharmaceutical products, oxidation is the #1 cause of product degradation. So ito yung #1 cause natin, bakit nasisira yung mga drugs na ginagawa natin. If they are being exposed to air, syempre air contains oxygen, yun, the product will undergo oxidation and pwede siyang masira. Hindi na siya magiging effective, hindi na siya useful for us. Okay? For some drugs, if they are oxidized, they may release metabolite that are toxic. So it will be harmful for us also. Therefore, a lot of pharmaceutical products have antioxidant in the formulation. Dinadagdag talaga siya sa formulation para hindi siya madaling masira. Okay? So isa itong sodium bisulfite. It's a water-soluble antioxidant. Okay? So that's the use pharmaceutically. Actually, marami tayong antioxidant. Vitamin C in the body is actually antioxidant kasi we have also a lot of oxidation processes in the body that may lead to the formation of free radicals. Itong free radicals are actually oxygen na -1. Yung oxygen, di ba natin is O2. Tapos pag ma-oxidize siya maging O negative, magre-release siya ng product na example O-1, it's a free radical, and then this free radical can actually cause a lot of conditions. So that is the reason why vitamin C is an antioxidant, and we use that for to boost our immune system. Okay? para hindi tayo basta-bastang nagkakasakit. But aside from that, these free radicals in the body may also cause the signs of aging, like yung mga wrinkles, mga eye bags, dark circles. Those are signs of aging. And we can also counter that through using antioxidants. So another example of antioxidant na ginagamit natin is yung vitamin E. So parehas sila ha, vitamin C and vitamin E are both antioxidant. Yung vitamin C lang is the same with sodium bisulfite. It's water soluble and it's used more commonly for boosting the immune system. Yung vitamin E naman is fat soluble. Kaya most of the time you can see that in soft gel capsule, it's fat loving and it's more on countering the signs of aging. That is why if you are going to look at commercials for our vitamin E, ang gina-advertise dyan nila is pampagwapa siya. Because again, that can counteract the signs of aging. Okay? Yan yung gamit ng mga antioxidants natin. And then, we also have sodium carbonate. Actually, si sodium carbonate and si sodium bicarbonate, parehas lang sila ng gamit. Number 1, antacid sila. Number 2, we can also use them as carbonating agent, both pharmaceutically and industrially. Pag pharmaceutically, we have a lot of pharmaceuticals na in effervescent na preparation. Tapos kung industrial naman, we have carbonated drinks para maging carbonating agent siya. And then at the same time, since this is basic in pH, then we can also use this one as an alkalinizing agent or an alkalinizing agent for our Benedict's solution. In your biochem, mag-biochem kayo next year, pasahasan ninyo ang farm in org para mag-biochem mo, you will encounter this Benedict's solution. Ginagamit ito siya as a reagent to test for the presence of reducing sugars. Okay? So, carbohydrates natin, ito example, glucose. Glucose is a reducing sugar. Tinetest nila yung mga substances pag meron siyang sugar or meron siyang carbohydrate, especially if reducing, magpa-positive yan siya sa Benedict's test. Okay? Pero sodium carbonate is just one component of the Benedict's solution and its role there is just to make the solution basic or alkaline. Okay? Now, in the laboratory, we have different forms of our sodium carbonate. It actually depends on the amount of sodium in its embedded on its crystal lattice. Kasi merong mga crystals class, example, this is crystal. Sa gitna, merong mga water molecule na naka-embed. So, tinatawag natin itong hydrates. Okay? So, kapag walang water doon sa crystal ng sodium carbonate, we call that anhydrous soda ash. So the name is dependent on the amount of sodium molecule embedded on the crystals of the sodium carbonate. Pag meron siyang dalawang water molecule, we call that trona. Pag meron namang 10, we call that washing soda, soda crystals, or sal soda. Actually, meron pa yung isa, pero yung possible lang is just like this one. Ito yung mga nag-exist sa nature natin. 2, 10, and then 7. Okay? So, na-mention ko kanina, effervescent preparations lang, just like the Berocca, tapos Fluimucil. Again, ito yung mga preparations natin yung mga drugs natin na before mo siya inumin, ilagay mo muna siya sa water. And as you place that in the water, mag-form siya ng bubbles. And then yung bubbles na yon signifies the liberation or the release of carbon dioxide. Again, the role of the carbon dioxide is to enhance palatability. Okay? Para lami imuhang giinom. That's the role of carbon dioxide. So our carbonating agent can be a carbonate or a bicarbonate. So pwede siyang sodium bicarbonate or sodium bicarbonate. But hindi lang yan yung ingredient ng effervescent preparation. Kung meron siyang basic na substance in the form of a carbonate or a bicarbonate, meron din siyang acid na involved. And then most of the time, we use organic acids for this, for our effervescent preparations. We have tartaric acid and citric acid, malic acid, or even vitamin C, the ascorbic acid. Ang kailangan nyo lang tandaan, pag gagawa tayo ng effervescent preparation and we opt to use the tartaric acid, kailangan partner talaga yan sila ni citric acid. Kagaya kanina doon sa magnesium hydroxide and aluminum hydroxide. Sabi ko, kailangan talaga sila i-partner para walang side effects. Kasi si aluminum can cause constipation, si magnesium naman can cause diarrhea. This time, si tartaric acid and si citric acid, may mga downside sila kapag single, pag solo mo lang siyang ginagamit. For example, tartaric acid. Tartaric acid can make the effervescent preparation na madaling masira. It will easily crumble. Okay? Pag citric acid naman, the effervescent preparation will become very sticky. Etong easily crumble yung sa tartaric acid kasi masyadong dry yung ating preparation kaya madali siya masira. Ito naman very sticky kasi it will be very like moist, ganon. So kaya isagol na to sila. Isabay natin sila with the effervescent preparation. Okay, together with either the carbonate or the bicarbonate. Okay, hindi pwedeng isa-isa lang kasi nga merong mga downside just like this one. Okay, I hope naka-take note kayo ha. And then, di pa tayo tapos with our daghan kayo no, isulod jud daw ni tanan sa atuang brain cells. Appeal jud ni siya tanan sa atuang exam. So ang inyuhang exam 65 points na multiple choices about this one, and some parts will be coming from the buffer and the indicators. And then the remaining 15 points will be problem solving involving the buffer solutions, yung Henderson-Hasselbalch equation. Yun yung magiging exam nyo. Nevertheless, yung 65 is more on the elements. So please listen and then please take note ha. Marami masyado akong sinasabi. Tapos konti lang yung nasa slide ko. So kailangan talaga mag-take note. But anyway, this is being recorded. I'll be giving the recording sa inyo also. Okay? Sige, sodium chloride. We all know this. I believe that, no? Alam natin ito lahat. It is our table salt. Or we call this the rock salt or the solar salt. So sa industry, syempre we use this one as a condiment para sa atong mga ginaluto. We can also use this one as a preservative. Pag maghimot tag bulad, ginabutangan og asin para to preserve the fish. Ganon. Preservative yan siya. But pharmaceutically and pharmacologically, sodium chloride is an electrolyte replenisher. Pampadagdag ng electrolyte, especially if we experience diarrhea, electrolyte imbalance, or even during fever. Kasi meron tayong electrolyte wasting during fever. So, pag na-hospital tayo, hindi lahat ng binibigay sa atin dextrose. Kasi yan yung maling paniniwala ng mga tao na kapag na-hospital, tas tinurukan, dextrose na agad yon. Again, hindi lahat ng nilalagay na IV fluid ay dextrose. Meron talagang dextrose class. Pero meron ding ibang IV fluid na wala talagang dextrose. Dextrose is actually glucose. It's our physiological sugar. Okay? Pero merong mga IV fluid like yung color coding yan sila if you're going to have your work or your internship sa hospital someday, makikita nyo dyan na yung mga IV fluid pala natin, naka-color coding siya. Yung green is actually the 0.9% NaCl. Yan lang talaga yung laman niya. And we call this the PNSS. PNSS means plain, normal, wait lang, saline solution. Okay? That's PNSS. And then kung nanonood kayo ng K-drama o kaya mga series or movies na yung genre is medical, you will hear the doctor during surgery asking for irrigation. Actually, irrigation is still this one, 0.9% NaCl. May nakalagay lang doon, PNSS for irrigation. Okay? Hindi kasi pwedeng, kapag nag-irrigation sila, example, during surgery, masyadong maraming dugo, and then isuction nila, and then to wash the remaining blood before suctioning, hindi pwedeng distilled water ang ilagay mo. That will be painful and that will have physiological na mga changes in the tissues and the cells. Kasi yung ating body, intrinsically and naturally, meron talagang salt. So, itong 0.9% NaCl, ganyan yung concentration ng salt natin sa body. So, kung meron kang ibibigay sa loob, kailangan parehas na amount ng salt para walang mangyaring masama sa patient. Walang physiological changes sa cells ng patient. Okay? So, yan yung example. Meron din tayong Ringer's solution. Pero yung Ringer's solution kasi na IV fluid pa rin ito ha. Tatlo kasi yung component niya. Potassium chloride, sodium chloride, and calcium chloride. Meron din tayong lactated Ringer's solution. Si lactated Ringer's solution, meron pa rin siya netong tatlo. Meron lang siyang additional na sodium lactate. So as you can see, wala silang mga dextrose na content. Lahat sila may sodium chloride pero IV fluid pa rin. And ginagamit natin ito as electrolyte replenisher. Okay? Sige. Now, sodium citrate. Citrate naman ito ha. C6H5O7. Ito yung citrate class. Ano naman ang gamit nito? So, number one, this one is an anticoagulant. Pag sinabing anticoagulant, it will inhibit blood clotting para hindi mag-clot, hindi magkumpul-kumpul yung dugo natin. Okay? Especially ginagamit ito ng mga medtech, 'di ba? Nagko-collect sila ng dugo. Tapos meron kasi silang mga procedures na hindi dapat mag-clot ang dugo. Wala na kasi silang makikita pag nag-clot na. So pwede nilang lagyan ng sodium citrate para hindi mag-clot and then they can proceed with the procedure. Kung ano man yung gagawin nila for the diagnosis. Okay? Now, ang problema natin dito, since it will prevent clotting, if this will be taken by the patient, pwede siyang at risk siya for bleeding or hemorrhage. Kasi nga, hindi magka-clot yung kanyang blood. Now, the anticoagulant action is not due to sodium. It's due to the presence of the citrate. Okay, again, it's due to the presence of the citrate. Now, other uses of our sodium citrate, diuretic din siya. Again, pag sinabing diuretic, it will increase urine volume. Okay, and it may also be used to treat chronic acidosis. Si sodium citrate kasi class is a basic substance or an alkaline. So since alkaline siya, pwede natin siyang i-treat if the patient experiences acidosis. Mababa yung pH ng kanyang body or kanyang blood. Okay? So it's an alkalinizer actually para mapataas yung pH. Aside from that, it's also a buffer. Yung sa lecture natin kasi yung pinag-uusapan na natin na buffer yung ammonia water and the ammonium chloride, and then we also have acetic acid and sodium acetate. But actually, the citrate, the sodium citrate can also act as a buffer. Mag-resist din siya ng changes sa pH. And aside from that, we also have expectorant. Pag sinabing expectorant, pampa-expel ng phlegm. So pag may ubo ang patient, dili basta-basta mo hatag og tambal. Actually ang tambal ana tubig. Pag dili na makaya sa tubig, kana maghatag na tag tambal ha. Pero pag pharmacist na mo pohon, please ask first the patient before giving drugs. Kay basig moingon sila, ma'am unsay tambal sa ubo mo? Moingon lang mo kalit na carbocysteine. Carbocysteine lang gid atong nabalaan nga drug para sa ubo. So hindi lang 'yon. Pag maka-encounter kayo ng patient na may ubo, paki-ask muna kung number one, productive ba or non-productive. Pag productive, meaning meron siyang plema. Okay? So pag productive, merong phlegm yan siya. Aray, wait lang. Yes, nakadepende kung may plema or wala. Pag productive, may phlegm ito ha. So, ang pwede natin ibigay, pwede siyang mucolytic or I'm running out of time again. Please just go back if maputol ha. Mucolytic or pwede siyang expectorant. Pag sinabing mucolytic, ito yung pampahumok sa plema class. Kung gahi ang plema, lisod igawas, ipahumok nato. And examples of mucolytic, we have the carbocysteine, we have the ambroxol. So you may choose ha. Please do not give these drugs if non-productive ang plema. Okay? And then the acetylcysteine. Itong acetylcysteine, ito yung sinasabi ko kanina pa sa effervescent preparation. Ang brand name niya, Fluimucil. Okay? That's mucolytic, pampahumok sa phlegm. Pag expectorant, syempre ito yung i-expel mo yung phlegm para malabas mo yung plema. Okay? May plema man, so ilabas natin using expectorant. So ito yun, sodium citrate can be an expectorant. But kung drug sa market yung hinahanap mo, we have guaifenesin. Okay? So, makita niyo siya sa pharmacy. Like Robitussin, that's guaifenesin, pang pa-expel ng phlegm. Pero board exam question, actually our best expectorant, board exam ito ha, it's actually water vapor. Magpausok ka. That's the best expectorant. Okay? So, you can choose ha if productive ang phlegm. Ang carbocysteine, I think that is not good for, merong age limit yung ating carbocysteine. I think if 2 years old pa, I'm not that sure, but wait lang, I forgot the age limit. May age limit ata yan. Though it can be given to kids, meron yan siyang caution for babies. Though meron din tayong drops for carbocysteine, pero just be careful sa ano ha. Safe naman siya, pero you have to consult the doctor first. Kasi Number one, pag asthmatic ang patient kasi, ang baby, actually, baby or kids, toddlers, ganon, bawal kasing gamitan yan ng mucolytic. Kasi, example, nag-ubo. So, hindi alam na asthmatic pala, kaya nagaubo. So, binigyan ng carbocysteine or yung any mucolytic, hindi kasi siya pwede sa asthmatic. Kasi pag nahumok na ang phlegma dinhi, pero hindi naman siya na-expel, nahumok lang, it will be deposited in the airways. And then, since marami ng plema dito and then hindi agad-agad na na-expel, mahihirapan um, increasingly yung patient sa paghinga kasi may obstruction na dito na plema. Okay? So kung asthmatic ang patient, anti-asthma talaga, or we may partner that with expectorant para ma-expel niya talaga yung phlegm. Hindi siya maging obstruction dito sa airways. So again, pwede siya sa bata with caution, especially if asthmatic ang bata. Ha? Hindi siya dapat ibigay. Samot na sila dili ka ginhawa. Okay? Now, tapusin ko pala, before I forget, meron parang palang non-productive na cough. So, ito yung mga cough na walang phlegma, walang phlegma. So, ang binibigay natin dito, antitussive. Pag sinabing antitussive, ito talaga yung cough suppressant. Do not give this drug sa productive ang phlegm. Ha, may phlegma na nga siya, tapos sinupress mo yung phlegm, hindi niya na yun malalabas yung phlegma. Nahihirapan siya maghinga niyan kasi naging obstruction na siya sa airway. So kung wala namang phlegma, antitussive, isuppress natin ang cough. Ang examples nito, we have dextromethorphan, yung tuseran, yan. That is a cough suppressant. So do not use tuseran kung merong phlegma yung patient mo. Or butamirate citrate. Butamirate citrate. Okay? Ang brand name nito is Sinicod. Yung Sinicod class, it's for non-productive. Okay? But be careful with cough, ha? Kasi there are coughs caused by asthma. So again, do not use mucolytic for patients with asthma. There are coughs due to allergy. So kahit ano mong inom dyan ng carbocysteine, for example, though meron naman talagang phlegm, pero hindi pa rin siya natatanggal yung ubo, it might be because you are allergic to something. So example, sa bahay nyo or somewhere else, causing your cough. And then meron ding cough na isa ka bulan na wala pa jud na ayo. It may be because gi-TB na atong patient. So be very vigilant kapag kasi these are OTC drugs, over the counter drugs. So these don't require reseta or prescription from the physician. So pwede lang nilang mabili sa pharmacy. So it will be your decision. Kailangan maayos yung decision making natin sa pharmacy para tama din na drug yung mabigay natin sa patient. Okay? And then, what else? Again ha, best expectorant natin is the water vapor. Though sodium citrate can be used as expectorant. Okay, and then we also have sodium fluoride. This one is an anti-cryogenic agent. Oh, before I forget pala, I forgot to write the test. Where is my pen? Paki-add. Daghan ba na itong i-discuss? No? Man siya ang mag-eskwela o pharmacy class. Daghan kita gina-discuss. Apil pa ni. This is a test to differentiate citrate and tartrate. So, yung solution na ginagamit neto is composed, of pyridine and acetic anhydride. Acetic anhydride in 3:1 ratio. So 3 parts of pyridine to be mixed with 1 part of acetic anhydride. Yan yung solution na ginagamit sa test. And then again, ginagamit to siya to differentiate citrate and tartrate. If your sample contains citrate, the resulting solution will be carmine red. Mo ni siya ang color sa solution during the test kung citrate ang iyahang unod. Pero if your sample contains tartrate, the result will be emerald green. Okay? Again, that's how you differentiate citrate and tartrate. It's the niche test. Please copy that before we'll move on to the next slide. Okay na? Sige. So, next, we have the sodium fluoride class. Lineage test. Unsa nang sa baba na test? A test 2. Test for the presence of citrate and tartrate to. Pyridine, oo. Pyridine and acetic anhydride. Tama yan. Pyridine. Okay, sodium fluoride. This one is anti-cariogenic agent. Pag sinabing anti-cariogenic or anti-caries, that is to prevent tooth decay. So yung ginagamit natin na concentration for our sodium fluoride is 2%. Pero we also have dentrifices. Pag sinabing dentrifices, ito yung mga substances na ginagamit to polish our teeth. Kung gusto ko sinaw yung mga teeth. Meron din yan siyang fluoride that's up to 1.1%. Okay, anti-caries yan ha or anti-cariogenic.